Hello, everybody. Happy Monday. It is January Cervical Cancer Awareness Month. And so today I am doing a live on pap tests, cervical cancer, new updates, things you need to know. So if you are watching this on YouTube or Instagram, Facebook, please tag a friend that could use this information as well. If you are watching this later, please hit replay and tag a friend who could use this info because there is so much misinformation about this topic and I would love to clear some of that up. So please ask questions during this live. I will try to make it short and sweet, just give you the high impact must need to knows. Okay. I'm Dr. Prabakar. I'm a board certified OBGYN. I practice in the Bay Area in California, and I am the founder of La Miranda Gynecology and Surgery. So in our practice, we do holistic care for women through all phases of life, right from menarche through menopause and beyond. So the topic of pap smears comes up very, very frequently. Lots of anxiety around it and lots of misinformation. So this January, let's clear that up, okay? So let's go over some basics. I have some notes here about the things I wanted to cover. What does a PAP test for? It tests for cervical cancer and cervical cancer only. All right. So it doesn't test for everything down there. I often have patients ask me that. It looks for abnormal cells of the cervix. So we are only checking for cervical cancer, not ovarian, not uterine, nothing else. Okay. And it also picks up HPV or human papillomavirus. Now, this is the virus that causes cervical cancer. It is an STD, and about 60 to 70% of American women actually have it. It's silent. And so you may not ever know that you have symptoms. And we test for it above 30 years of age. Okay. So if you're getting a PAP after 30, we add in the HPV, and you'll get a result from your doctor that says you have a normal PAP, but positive HPV, or you've got normal both or positive both, whatever it is, you're going to hear about the HPV and the PAP. Now, where exactly is the cervix? The cervix is the opening of the uterine cavity, and the cervix is found through the vagina, right on top. It's a little nodular structure where the PAP is actually done. So that's where the cervix is. It requires getting a speculum in, opening up the walls of the vagina, looking at the cervix, and then taking a little sample from there. So speaking of sample, what exactly happens during this exam and what is required for a PAP? I just realized that I forgot my little props. In my exam room, I wanted to show you guys the little things that we use, but okay, I'll make another reel for that. So let's talk about the actual PAP. What happens during a PAP test? There's so much anxiety around a PAP test. It is not the most comfortable exam. Okay. It shouldn't be painful, but it is uncomfortable and it's very quick. A PAP done well can be less than 30 seconds. Okay. 20 seconds. It's very, very quick, but the whole process can cause a lot of anxiety. So if you're somebody who's had a history of trauma, a history of sexual abuse, if you have PTSD and just anxiety over this whole thing, please let your doctor know ahead of time. You can even bring a friend or a partner in with you for moral support. Sometimes that makes people feel better. Tell your doctor this. You can ask for a smaller speculum. We have a variety of sizes, so you can ask for something smaller, and you can also ask for the self swab, which I'm going to talk about in a second. But imagine you're getting the traditional PAP test. You come in, you talk to your doctor, then you're laying down on the exam table. Your feet do have to be in stirrups. Okay, so we've got these two stirrups that come on the side. Your feet go right on there. We put a speculum into the vaginal canal to open up the vagina to see the cervix. We have a little brush. We take the sample and we remove the speculum. So like I said, a well done PAP can be 20 seconds. So it does not have to be long or painful, but it is not the most comfortable. All right, I wanted to talk about some embarrassing questions that patients often are nervous to ask about. Okay, so can you get a PAP during your period? The answer is yes. As long as you're not having a heavy flow where you are changing a pad every hour, an hour and a half, if you're having a little bit of bleeding, that's not a problem. We can often just, wipe away that blood and still do the PAP. So if you've been waiting for this appointment for 2 or 3 months or more, and you just started your period, that is not a reason to cancel. Okay, number 2, do you need to shave or groom for your PAP? The answer is no. Again, we're not taking samples from the vulva, we're not taking samples from the mons, we're going right into the vagina to the cervix. So no, you don't need to do any of that. What if I'm super nervous and I can't relax? So as I mentioned, you can bring a friend or a partner. The best tip I have for relaxing during a speculum exam is as the speculum goes in, you should actually try and breathe out and push the speculum out. This actually relaxes the pelvic floor. This was a trick taught by one of my attendings during residency, and I use it all the time when I'm doing exams, and patients are like, wow, that actually worked really well. So imagine that you're pushing the speculum out and that relaxes your pelvic floor. We're able to do the PAP really fast. And then lastly, can you ask for a smaller speculum? Yes. If you're somebody who is very nervous about this, you've had pain before, and you want to get the PAP, you want to keep up with your cervical cancer screening, but you are afraid of the speculum, please, you can definitely ask for a smaller speculum. And most GYN offices have a wide variety of sizes. Okay. Please type in if you have any questions that will come up here. If I don't see them in time, I will make some content and post that right after. Okay, so now how often should you get a PAP? There is so much confusion about this because, to be fair, the American College of OBGYN has changed these guidelines quite a bit over the last 10 years. It used to be every single year, and people used to equate a PAP with your annual GYN exam. I went to my gynecologist, of course, I get a PAP. Those were synonymous. Then it became every 3 years. Then it became every 5 years. So what is it as of 2026? This is January 2026. As of now, what are the recommendations? So let's hear it. We start at 21, okay? We start getting PAPs at 21, not 18, not when you're first sexually active. Those used to be older guidelines, but we actually start when we are 21 years old, okay? You get it every 3 years. So the PAP is done every 3 years if you are 30 and under, okay? And we don't do HPV. So we just do the PAP test. We do the little scraping, get the cells, but we do not test for human papillomavirus because a lot of times women who have HPV clear it because they are young and they have a good immune system. If you're above 30, we do the PAP with the HPV, and this test combination is done every 5 years. So you start at 21, you do it every 3 years. If you're under 30, you add the HPV and you do it every 5 years if you're above 30. And then you stop at 65 if you have had 3 normal PAPs, if your last 3 PAPs have been normal. And the reason why this is, if you've had normal PAPs, normal HPV tests, it is unlikely to suddenly develop cervical cancer because this takes a long time to develop, often 8 to 10 years. And this HPV has been acting up on your cervix over time, causing changes that can actually lead to cancer. So if you've had normal PAPs and at that age point, normal PAPs and HPV for 15 years, it is unlikely that you're suddenly going to develop cervical cancer. Now, the caveat to this, of course, is if you have a new partner, or multiple partners, then I would talk to your doctor and plan on continuing some screening for a few more years. Because again, HPV is a sexually transmitted virus. And so maybe your PAPs for 10 years have been normal, but now you are with somebody new you have a higher risk of getting a new strain of HPV. So discuss this with your gynecologist. Okay, so there's one other new development here with PAPs, which is a self swab, which I love. The self swab only checks for HPV. Okay, so it does not involve a speculum, it does not involve scraping cells from the cervix. It is solely a swab that tests for HPV. It's very simple. You open up the container, it's like a COVID test. You put it in the vagina, twirl it around for 20 seconds, close it, and give it back to your gynecologist. Is not approved for home testing yet, although this is coming very soon. But right now, you can do it at your doctor's office, and you can do it yourself. So for patients with a history of trauma, you're embarrassed, you just don't want that speculum, it's uncomfortable. A self swab is a great way. It tests for HPV. So if it's negative, you're good for 5 years. This is an adequate form of cervical cancer screening. Okay. Now, if it comes back positive, then you do have to come back and actually get a speculum exam and get that PAP and get those cells scraped off and tested. But this is a great alternative. Instead of putting off your GYN exam or saying, I just don't want to do it, it makes me nervous, I don't like it. This is a great way to still get your screening done in a relatively comfortable manner. Okay, so the self swab, please make sure you ask your doctor about that. Now, next, let's move on. What do results mean? Okay, so if there's again a lot of anxiety about PAP test results. So let's talk about that. If you get a normal test, great. You're good. You come back in, for your PAP in 3 years or your 5 years, depending on your age. This does not mean you go back to your gynecologist in 3 years or 5 years. You should have a GYN exam every single year, because we still do a breast exam, we do a pelvic exam, we talk to you about menopause. There's a lot of other things that are covered in a GYN exam, but the actual PAP can be done every 3 to 5 years, again, depending on your result. Now, if you get an abnormal result, your PAP is abnormal, or you've got HPV, now, this is a much more nuanced discussion with your physician about what strain you have and, what grade your PAP is. And in this case, a next step may be a colposcopy, which is where we use a little microscope to look at your cervix and then take a couple of biopsies. So this can definitely be the case, again, depending on what your results are. But just because you have a positive test does not mean you have cervical cancer. I think that's the biggest message I want to send out in this section. I get a lot of phone calls with people freaking out. Oh my goodness, I have cervical cancer. I'm going to get cervical cancer. This does not mean you have cervical cancer. This just means you need a little more follow-up than somebody who had a negative test. Okay, so don't get worried, but please see your doctor and you can figure out what's next. Sometimes, even though you have an abnormal test, the next step is just to repeat it in 3 years. If you have a slight abnormality, there's really nothing to do at this moment. You just repeat it, at your next interval. So based on your test results, it could go many different ways. But the most important thing is to have a discussion and don't think you have cervical cancer right away. Okay. All right. So we've discussed what a PAP test is, what it screens for, the process of getting a PAP, how a PAP is done. We've talked about some embarrassing things that patients are often afraid to ask. We've discussed self swab, and we've also discussed, what comes next after your PAP. And when you get a result, what do you do? What could potentially be next? So hopefully by now you guys have had a good idea of the PAP test, the screening recommendations, how often you need to get it, and what happens when you get an abnormal result. So let's go over in the last few minutes some frequently asked questions. So do I need a pap smear if I've never been sexually active? Okay, this is something I get asked a lot. The answer is no. You do not need a pap smear if you have never been sexually active. And by that, I mean if you've never had, penetrative intercourse or that you haven't been sexually active that way. This does not count for other types of sexual activity. But if your cervix has not been exposed to HPV that way, you do not need a pap test. So, for example, I'll have somebody who's 30, never been sexually active. They find the whole thing extremely uncomfortable, as I would imagine. They've never even been with a partner, and they've been getting paps every year. So that is completely unnecessary. Now, if if you're not sexually active at that moment, so maybe you've been sexually active in the past, but for the last 3 years you have not been sexually active, do you need a pap? The answer is yes. If you have ever been sexually active, you need a pap, because HPV can be a little sneaky. It can be negative for several years and then pop up later on in life. So even if you've had it way back, maybe you cleared it, you never knew you had it could still be hiding in your system and can pop up later. So you should definitely still get a pap if you've ever had a history of being sexually active. What about after menopause? Do you still need a pap? The answer is yes. So if even after you've reached menopause, you still need to continue your pap test per your usual cadence, because again, a pap test for cervical cancer. Menopause has nothing to do with decreasing your risk of cervical cancer. What if I'm transgender? This is another question. If you have a cervix, regardless of what gender you are or you're transitioning, you still need a pap. If you have a cervix, you need a pap, because again, a pap tests for cervical cancer. So these are some of the questions that I have had patients ask me or have been embarrassed to ask me. So I wanted to clear that up with you guys right here. And I would love to take any questions. I know it's lunchtime on Monday, so it may be in the middle of your working day, or maybe you're not able to watch it during your lunch, but no problem. You can always hit the replay and ask any questions that you have. And this January, which is Cervical Cancer Awareness Month, I want to leave you guys with some takeaways. The number one is that cervical cancer is preventable. Okay, it's an entirely preventable cancer. This is unlike breast cancer or uterine cancer or the many other cancers that we have in our body that just pop up, without any notice. Cervical cancer is entirely preventable. And this is because it is caused by a sexually transmitted virus, HPV. So the fewer partners you have, the less your risk is, and or the more you get screened and the more you keep up with your screening, the less your risk is. Because this is a very slow growing cancer. Typically takes years to actually come up as cervical cancer. And so there's many opportunities to catch it and do things to minimize your risk of actually getting cancer. So number one message, it is entirely preventable. Number two, a GYN exam does not equal a pap smear. So maybe you don't need a pap test next year. It doesn't mean you just completely switch off from going to the gynecologist. We cover a lot of other important topics. We do other exams. So really, really important to make sure you see your GYN every year. And the third takeaway I want to leave you with is a self swab is available. So if you are somebody, again, who just detest the idea of going to the gynecologist and getting a speculum exam, you find it uncomfortable, you don't like it, ask for self swab. If you are 30 and above, this is actually a perfectly normal and acceptable way of screening for cervical cancer. It screens for HPV, which again, if you're 30 and above, we can use that test as a primary screening method. So hopefully you guys have learned some things about PAPs and cervical cancers in the session. Again, please tag a friend who could use this information. Please ask questions and I'll create more content for it. And if you are someone in the Bay Area who's looking for a gynecologist, maybe you're behind on your PAP, you really need to catch up, please call us and make an appointment. We'll be happy to see you. And until next time, have a great Monday and have a wonderful week. I'll talk to you guys later. Bye.